My name's Dr. Murray Gillies. I'm currently a technical services veterinarian with Vitacquinol Canada. It's a local pharmaceutical company here in Canada. And I'm also the dairy subject matter expert for the Canadian Veterinary Medical Association's SAVME project. And as a little bit of an aside, I'm also a local dairy farmer here in Sussex, New Brunswick. So. Right, so I was born and raised on a dairy farm, actually. So I've been around animals all my life. You might see my little boy in the background there, Barry. So, you know, on the farm, we've got dogs, cats, cows, chickens, pigs, horses, goats, you name it. So, you know, that lifestyle, it led me to pursue my Bachelor of Science at the Nova Scotia Agricultural College, which then further led me on to my veterinary degree at the Atlantic Veterinary College, which has essentially brought me to where I am today. This has always been something very important to me, antimicrobial use and antimicrobial resistance. One of my professors actually at the veterinary college and PEI, Dr. Jane McClure, was quite passionate about antimicrobial use and resistance, and that sort of rubbed off on me a little bit. So I wanted to take that a little bit further, definitely, since antimicrobial resistance has been recognized as one of the top threats facing human health and animal health, essentially One Health today. So I was actually lucky. I just happened to be the president of the Canadian Association of Bovine Practitioners at the time that the SAVME project was starting up, and they asked me to take on the role of the dairy subject matter expert, which I agreed to, and I'm happy that I agreed to it because I've been able to stick into that role right up to today, and hopefully we'll continue that role going forward. Yeah, so I think all field veterinarians will actually benefit from this information and from the tools that are being rolled out in the SAVME project, not just for applying better treatments and rational use of antibiotics, but by generating better withhold times for food safety and better overall One Health for our animals and ultimately our human society. I sort of in my talks around antimicrobial use, as you say, veterinarians are very well trained and very well positioned to prescribe antimicrobials in a judicious manner, or they're seen as the experts when it comes to antimicrobial use. But I try to challenge that notion a little bit. Certainly on the human side of things, you know, they're prescribing antibiotics to one species, they're very common diseases, and they're seeing a lot of people. But on the veterinary side, we have to prescribe antibiotics to a wide range of species. You know, we've got cows, we've got horses, we've got chickens, pigs, dogs, cats, fish. We even have honeybees, and all of these antibiotics come in different products. They come in different formats. There's different dosages, there's different doses, there's different methods of administering them. And then there's considerations along the lines of residue avoidance, withhold times, and the transmission of zoonotic diseases. So certainly it's difficult for a veterinarian to actually be an expert when it comes to all prescription and use of antibiotics to all of these species. It's not actually physically possible to know all the drugs you can use in all the species for all the diseases and what routes, what administrations, what withhold times we should be applying to that. So you know, the app and the tools that have been developed in the SAVME guideline is sort of standardizing a lot of that information that will allow veterinarians to actually further their expertise and be seen, you know, as more of the experts when it comes to this, to the use of these products in animals and in people and in a One Health perspective. Yeah, certainly quite a few improvements. So the biggest improvement obviously came in 2018 when they first started the guidelines, when we moved it from a paper version to a book, which sort of covered the biggest diseases, the most common diseases that we saw across the major species, which at that time was just poultry, swine, cattle, dogs, and cats. The 2018 guideline moved that information to a web-based format, and allowed us to add a lot more diseases in there and a lot more different uses of antimicrobials. And then building on from that, as information changes, obviously, and as we recognize a need for further information, we were able to take that information, update it, and then put it in a much more readily accessible, user-friendly format in the app. So veterinarians will be able to access all of this information in real time, you know, right beside their patient, whether it's a dog or a cow. They'll be able to pull up the information that they need at the few clicks of a finger And we've been able to expand that across a lot of different species now as well. As I said, we started with the big ones, but we've added in aquaculture, we've added in small ruminants. You know, we're looking at adding in honeybees in the future, and we'll also be able to continually update the major species as the science, the evidence, and the uses and the microbiology changes. Yeah, absolutely. I think there's room to improve. They haven't even been launched yet. So when we launch things out to the wider veterinary profession, you know, ideally we'll get feedback from experts, from field vets, whatever, about the information that's in the guidelines. Science is always changing. Biology is always changing. Recommendations are always changing. You know, the bacteria are always changing. So these guidelines will never be one fixed thing. And we'll just be able to use going forward. So we will essentially be able to continue to update these guidelines as all that changes, you know, to address the new evidence and the new science and the new things that are being put forward. So a really nice utility and function of that app will be, as soon as somebody makes a comment or somebody publishes some new information, it won't take very long to get that information updated in the app and keep it accurate in real time for the veterinary profession. I think I would encourage all vets to use the app. You know, and there's a human health side too. So hopefully their human health counterparts, the medical doctors, will use the first line version, their version of the first line app. But definitely in the veterinary field, I would just encourage all users, you know, young and old. I particularly see this as being a very useful tool for young veterinarians, new graduates, since they're sort of in the prime of when all that information is changing and science is changing. And they're obviously going to be the most affected by changing regulations and changing resistance. You know, if you're going to retire in the next 5 years, resistant pathogens may not be high on your list of priorities. But if you're just starting your career, you're definitely going to want to be able to treat common diseases, you know, over the next 30 years. And if we lose that ability, it's not going to be great. So young veterinarians, particularly, I think will benefit and should use this app. But all veterinarians definitely still practicing in the profession. There's a lot of smart ideas, a lot of opinions went into developing these guidelines, and there's always room for more. So when they do launch the app, when that information gets out to our veterinarians, provide your feedback. Certainly we welcome all discussion, all feedback at any time. So don't hesitate to use it. Don't hesitate to comment on it. And don't hesitate to help in the updating process of the app. It's a very ambitious project. I'll say that for sure. Certainly our colleagues in the US don't have anything of this magnitude, so we're sort of ahead of the buck here in Canada. But I can say with confidence that our colleagues in the US are very interested in what we might develop here, and we might even be able to collaborate that further into a better One Health approach for all of North America, which is essentially what we will need to do. So I hope that everybody's excited about the tools, the Savvy project and the app. I hope they use it. There's a huge amount of benefits there. And we'll see over the next couple of years, you know, just how useful and how strong this information can be in tackling this huge issue, which is antimicrobial resistance.